Did you know UTMB has launched a new blog? They're excited to raise awareness of their clinical team, services, and relevant health and science topics. With that goal, they've recently launched a new health blog that is available online at utmbhealth.com/health-blog.
The numbers were very high. The hospitals were overwhelmed. The frontline staff, I've seen them cry with every patient that they lose because they develop such a connection. It's a lonely disease. They become their family, their support system. They become everything to that patient.
Welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today I'm joined by Dr. Miguel Nunez and Sarah Achour. Did I get that right?
You got it right. Yeah.
Okay.
I'm impressed.
They're both with UTMB, and we're finishing up our series on travel, and so we're going to be talking about travel during the current time. Before we get into that, if you would both tell us a little about yourself, and we'll start ladies first, and then we'll go on to Dr. Nunez.
Okay, so I'm Sarah Achour. I am an infection preventionist at UTMB. I work for the Infection Control and Healthcare Epidemiology Department. I've been in the field for about 12 years now, and infection control and infection prevention and epidemiology. My bachelor's degree actually was from UTMB, clinical laboratory science, specifically in microbiology, and then I wanted to further it more and did public health from Johns Hopkins. So in a nutshell, that's me.
And so you've been probably very busy this last year and a half.
Very busy. Yeah, it's been a very challenging year, and I think this really brought to the forefront the importance of public health and infection control and infection prevention. It got a lot of attention, and I think it's some good things are going to come out of this. We're going to learn a lot.
Dr. Nunez?
So I'm Dr. Nunez, and came from New York. I did my residency of internal medicine in Brooklyn, then joined UTMB in 2015. Started in CBC, Lake City. Then I was moved to the Webster location. It's called UTMB Primary Care and Pediatrics. I'm the medical director there, and I've been there already since I said 2015.
And so I wanted to ask you, because I don't think a lot of people realize that at the beginning of the pandemic, you were in high demand, obviously, but a lot of other medical professionals were either furloughed or there was a real effect there. Did you guys feel that at your clinics?
Definitely. So I'm an outpatient mainly. So the outpatient part was definitely hit because the clinics were closed, and we were diverted to COVID clinic, what it was called COVID clinic, where any patient that was having suspicious symptoms of COVID, they would come to us, and depending on after evaluation, we would either do the COVID test and send them home or the hospital. But definitely it was, we couldn't see the main patients that we see, which are continuing the care of chronic conditions. So that totally stopped because of COVID.
And then, and you're both, I think, going to have different answers to this question, but from your standpoint and what you do at UTMB, how close are you back to somewhat normal operations, or at least operating normal levels of seeing patients and things like that?
So we are normal, we could say, because we're seeing every single patient, depending on the clinic. So some clinics have the availability to separate the patients of follow-up chronic conditions, and others that have possible or suspicious symptoms of COVID, which could be any respiratory symptoms. So those ones are seen in another part of the clinic to not mix those patients.
And then Sarah, my guess is your normal is very not normal or hypercharged?
From infection prevention standpoint, and we continue to implement things, and COVID is still a big part of our day-to-day activities. But for the facility itself and for the clinics and everything, at the very beginning, we didn't know that much about COVID, and we were trying to implement policies very quickly with little information and change it very quickly as we learn more. So that's where, in addition to, we had other challenges with supplies and PPE and shortages, where we had to conserve all of that stuff for COVID patients, expecting that surge to come in, so we can be well prepared. And in that case, other care has taken a back seat, and we had to kind of stop some elective procedures, and some of the clinics weren't functioning the way they were supposed to. But now we know a lot more. We have policies. We have streamlined those policies. Everybody knows what to do with all the patients. Everybody has learned enough about COVID to do so. And we have plenty of supplies. And so with all of that together, we're slowly coming back to that normal. We're seeing more patients, more elective procedures, more activity. And another thing is, patients were scared of coming to the hospital because of COVID. Now that fear has subsided a little bit, especially with the vaccination efforts that are going on. And again, with information that's available now that we know.
Yeah, I've kind of noticed that hospital and medical marketing kind of changed, and you brought up a great point. It was all about, it's safe to come and see us. In fact, it's more important than ever that you come see us.
Yes.
And then there was also a lot of obviously thanking you, first responders. And so thank you to both of you for, being on the front lines and really helping fight this. So, but one of the things I really wanted to talk about, one of my passions is travel. I love to travel. Every summer, my family and I, we like to take an international trip. And I thought that, okay, I would miss that 2 weeks of going on vacation, but it's more than that. It's this hope. It's this planning the trip. It's looking forward to. It's actually doing the trip. Yeah. So it takes a lot more away from you. And now, as people are starting to get vaccinated, hopefully we can start traveling again. So what we really want to focus on is how we can do that safely. Yeah. So what would be your top kind of 3 recommendations of what we need to look for if we're going to take a big trip, either internationally or locally this summer? So if feel free, either one of you, to kind of bounce around on this one.
So the safest trip that you can take is a trip that's within driving distance. That way you avoid public transportation. The risk of exposure is lower. And then you can plan outdoor activities and things like that, because again, we know that outdoor activities are to less risk than indoor activities. That's one way to go. Another thing is, use the resources that we have available. So, for example, the CDC has a website that's called the COVID-19 Travel Recommendations by Destination, and it has a map of all the countries and all destinations. It assigned a risk level for each country based on the number of cases that it has, the variant, the type of vaccine efforts that are going on in that country, the lifestyle of that country. Is it a crowded country where there's always public transportation, impossible to maintain social distancing or not? So they take into consideration a lot of things, and they assign a risk from 1 to 4, 1 being the lowest, 4 being the highest risk. And it gives you a set of recommendations on what you should do. And it'll tell you, we do not recommend that you travel to this country. And if you do, this is what you should be doing, just a list of things that you should be looking for. So that's another thing. Making a good educated decision is going to make you safer. The third thing is just being aware of your surroundings. Wherever you go, wherever you end up going, make good decisions. For example, outdoor activities are better than indoor. If you want to dine at a restaurant, eat outside in the patio if they have one. If you go and you feel like, okay, well, they have good, they're able to maintain social distancing and the capacity is not 100%, I feel safe. So you can go and dine in that area. If not, if it's too crowded, walk away, find a different location. So those are our 3 recommendations. And
okay. And Dr. Nunez, anything to add to that?
Also, airlines give you information about entry requirements wherever you go. And also, I think you definitely should have a COVID test before you travel. So, I mean, because if you test positive, then you definitely should avoid and isolate yourself to stop the spreading.
Mm-hmm. So, you were originally from New York?
No, I'm originally from Dominican Republic.
Okay. And have you been back since the pandemic started?
I have.
Okay.
Yes.
So tell me what the travel was like to the Dominican.
So there was no requirement to get in there, but coming back, American Airlines would require a negative COVID test, including American citizens, to be able to board the plane.
Okay, so you had to get that while you were there, and then
72 hours prior to.
Okay. Have you traveled since the pandemic?
Abroad, no.
Or anywhere locally?
Locally, yes, but we have not used public transportation since the pandemic began, and we just go within driving distance.
Yeah, that makes sense. I think my family, we've been to Fredericksburg, and we've been to Brenham. You know, some nice, quiet, like you said, not crowded, and very, you know, you feel like you're able to space out, like you said. So
yeah.
So, but let's say, COVID notwithstanding, you know, there's other things that go into travel and staying healthy. For example, jet lag. Let's say we are going to travel internationally. How do we prevent jet lag? Because that can be a real drain.
Well, it's hard to prevent it, but there are many things that you can do about it. Probably taking a very late night flight. If you're going east, that will help you if you sleep throughout the flight. So when you get there, it's early morning. Try to eat the meal at a proper time zone time, and try to exercise. Keep hydrated. Also, try to do many outdoor activities in the afternoon. So when the night falls, then you can go to sleep.
Yeah.
Try to go to sleep only if it's dark.
Yeah, and that's we used to fly back and forth between Europe a lot because I'm originally from Europe, and so I would always stay up as late as I could, but my wife would always just crash, and I'm like, honey, you got to stay up. If not, it's gonna. And, and the kids are the same way, so I really try to push them and hey, let's go for a long walk and get lost, and hopefully we'll find our way back at night. So what else should I be concerned about when I'm traveling? For example, I know a lot of people get worried about blood clots, things like that, especially with air travel. What else should I be looking out for?
Definitely blood clots. I mean, the longer the flight, the more at risk you are. I would definitely recommend you to, during the flight, just move around as much as you can. Try to not cross the legs, and try to use light clothes, not too tight, because that could restrict the blood flow. And that can definitely form a blood clot.
Okay. And so what kind of permanent changes do you see to the way people are going to travel because of the last year and a half?
I think they learned a lot about infection prevention strategies, and I think there are some practices that were put in place because of COVID, like disinfecting certain surfaces more often, masking when people are sick, things like that. We might keep these practices for a good time. And for example, the flu this year, because of the masking practices, has declined. I've never seen a better flu season than this. So these are good practices. It actually ended up preventing quite a bit of respiratory illnesses, and because of increasing hand hygiene, even GI viruses and things like that, we're not seeing them as much as we normally do around this time of the year.
So there's some silver linings. Hopefully we get out of this, and we're all going to be healthier when we travel from now on.
Yeah.
One of the things that I hear a lot from people is every time they go on vacation, they come back and they get sick. Mm-hmm. Can you explain why that is, if it's real or if it's just perception?
It can happen. You're exposed to more surfaces. You're touching more things. You're in contact with more people. And it's people from all over the world. Like the airport is just a hub of, the whole planet in that one space, so you don't know who has what. And then if you're in an airplane, a bus, a train even, it's a small space for a prolonged period of time. You're exposed to people that you're not, that you don't know, and you don't know what they have and what they don't. So the risk is there. The more exposure there is to other people and other surfaces, yeah, it's likely you'll catch something and get sick.
Yeah, and I remember distinctly, I got on a plane one time, and the guy that sat next to me, he just didn't look quite right. And I'm thinking to myself, oh, come on. And I did. I ended up getting sick, and I'm thinking to myself, oh, I don't think that'll happen necessarily going forward with the new safety protocols.
So when it comes to this pandemic, one thing that happened, people were afraid and they wanted to protect themselves, right? But more than ever, we have to be selfless. And we have to feel a sense of responsibility to protect others. So being symptomatic and flying, or having a pending COVID test and flying, or knowing that you've just been exposed to someone with COVID and flying, is something that's not, of course, recommended by the CDC. And as human beings, when it comes to doing the right thing, that's something that we should not do at all. What can control this pandemic is that sense of responsibility and the fact that we are protecting each other. It's a very selfless mindset that we have to be in.
You know, and I like that because, and we've had this discussion at work, is, you know, we're asking people, if you're feeling at all ill, stay home, right? But then we need to review as businesses, small businesses, we need to review our HR practices to make sure that we're asking people, like you said, to be selfless. And then you can't have HR practices that then are punitive, you know, because you were absent, because you were trying to do the right thing.
That's exactly right.
Do you guys talk about that at UTMB about, you know, trying to align those HR practices to what, you know, all of these recommendations, what that means to HR?
For sure. That's the first thing that we've done, because one of the main things we've had to implement is, if you're sick, please do not come to work. And we had to screen ourselves every morning because we're coming in, we're going to expose patients, we're going to expose our coworkers, we're going to have a whole workforce going home sick with one person that comes in with symptoms. So yes, HR was very, very supportive. They did implement policies that go hand in hand with our infection control recommendations and policies. Yeah,
and I would really encourage our small businesses to do the same, and make sure that, you know, there's alignment there, that you're not saying, okay, if you're sick, stay home, but then it counts against you on your review. So
and think of the future. One sick employee staying home is better than 5 sick employees staying home in about 5 to 6 days, because they just exposed all of them. So it really ends up for the benefit of everyone after all.
And so at the clinic, let's say you have a patient that comes in and there's the suspicion of them having COVID. Kind of talk me through the protocols of what you would do at that point to kind of mitigate, like you said, the spread at that point.
So patient first checks in. And so when the patient is checking in, they're asked some questions if they're positive. I mean, with one of those within the last 14 days, then the patient is sent to the other side of the clinic where we take any possible case of COVID. And it doesn't matter, sorry. And it doesn't matter why they came for, if they came for diabetes follow-up, but they do have a COVID symptom, possible COVID symptom. So then we go to the other side and we take care of that and COVID symptoms that they're having.
Okay. Yeah, and where I work, we've actually had people after they've come and visited us, as they're leaving, tell us, oh yeah, I have COVID. And I'm like, you know, like we talked about, where's that responsibility of staying home? But you're being a medical provider, you know, I mean, where else are they supposed to go? So that's an excellent point with the personal responsibility.
We're also still offering telemedicine. So if they don't want to go to the site where there are many patients with possible COVID with any respiratory symptom. So if they don't want to go there, they still have the option of seeing their provider through telemedicine, and we'll still take care of them.
Okay. And how has that evolved over the last year? You guys feel like you're much better at it? And
So yes, definitely much better. You feel more comfortable in doing it. We still feel, the physical exam should be there. So for many probably mild acute conditions, as the cold, that's probably not a problem. But for others, like a wellness exam, diabetes checkup, is always good to have the patient face to face and be able to have that physical exam.
Okay. Yeah, my mom is currently undergoing cancer treatments, and she won't do the telemedicine thing. She says it's a product of age, and I'm just like, well, give it a try. But I know a lot of people that have done it over the last year and have found it to be very beneficial, not having to get out, not having to expose either themselves or other people. So
it is beneficial, but it could be risky too. The fact that you're not examining the patient, you may not find out things that can actually be in the future lethal.
Yeah. So you're thinking in the future there'll be a hybrid of this. We won't rely strictly on telemedicine.
I would say that there are several conditions that you can definitely do it with no problem. Let's say a depression, someone who has depression or anxiety on a medication that has been controlled for several months or a year. It's just a refill, and we can have a conversation. There are many psychiatry that they don't do in a physical exam. It's just a talk, and that's probably fine. But there are other conditions that you definitely need to see the patient face to face.
So we like to talk about buying the Bay Area, so I'm going to ask you a few lightning round questions about some of your favorite local things. But before we do that, I'm going to go to Sherry Sweeney with the Chamber for some important announcements.
Hello, Clear Lake Area Chamber of Commerce members and Bay Area Houston. Since we're talking about tourism today with UTMB Health, we want to let you know our monthly luncheon in May, on May 26th, will be at Landry's at the Kemah Boardwalk. We're going to focus in on tourism and how it affects our local community and the state of Texas.
All right, and we're back. Thanks, Sherry. So since we're talking about travel, I love to travel, so I'd love to hear what your dream vacation is. So what would be your ideal vacation?
My ideal vacation is being on the Mediterranean, anywhere on the beach.
And have you been before?
I have. Yeah.
It's fantastic. I took a cruise all around there. It was amazing.
Beautiful. Yeah.
Dr. Nunez?
I would say I would love to take a cruise to Antarctica.
I think my wife, that's her last bucket list check off for continent. She's in them all except for that one. So she's really wanting to do that cruise where, like you said, you can go all the way down to, I forget what they call the point of Argentina.
Ushuaia.
Yeah. And then they do a side trip to Antarctica, and I think it's like a $10,000 excursion.
It is. It is very expensive. Yeah. But I mean, definitely, that's something that you need to.
Yeah.
Then you need to see.
But like I said, dream vacation. So.
And probably if you stay there, you'd probably be safe from COVID. There's not many people living there, so it's only penguins and.
It's the ultimate social distancing vacation. So, like I said, we talk about buying local, staying local, and our hospitals like UTMB have really given our residents the ability now to not have to drive beyond this area to experience great medical care. So, thank you for that. Is there anything else you'd like to add about safe travel or what we've experienced the last year, what it's meant to you and your organization?
Actually, so UTMB was fairly new whenever the whole COVID pandemic began, the hospital here. And I think its presence in the community was very, very prominent, especially when it comes to testing. There was a lot of testing challenges. We didn't have testing. We didn't. The turnaround time was 7 days to 10 days or so, and UTMB at that time started testing probably the very, very, very early in the pandemic, and their turnaround time was about 72 hours or so. It really allowed us to test more and perform contact tracing and keep contact with the health department and quarantine. And I really think it played a very, very big role in keeping our numbers somewhat under control in this area.
Yeah, and let me tell you, my wife did her vaccination through UTMB, and she said the process was amazing, and she was so pleased with the whole process, the ease, the setup. It made her feel safe, and so she's been so glad that she went through UTMB to take care of that.
Yeah. That's really great. But I tell you, it's been a challenging year. Hopefully we learned a lot from it. COVID is still here. Well, we have to be very, very careful. And we're lucky enough to have the vaccines now available. And I encourage everyone to go ahead and get the vaccine in order to get this pandemic under control and to protect our community altogether from this.
And Dr. Nunez?
I think it definitely, especially, it was definitely was a very challenging time, and I think we have learned a lot. Especially patients. She mentioned that we didn't see that much flu this year, so just if we continue to do the same, flu will be low every single year. So that definitely that was a point that that we got from this time. Also, we have to encourage the vaccination. There are most of the patients that I see, they definitely have been asking for the vaccines since the beginning. I see very rare. I see one that would say no, but I'm sure that there are many people that wouldn't have the vaccine, and just to encourage those patients is safe. You can see, how many people have it. If it's just a mild fever that you're going to have the day after the vaccine, is better take that than COVID, and then they spread it to your family, to your friends, and to others. So you just think that the risks for the vaccine are way too less than the COVID itself.
Well, and you hit on it earlier. It's like the double shot of personal responsibility.
It is.
You're keeping yourself safe and you're keeping others safe. And so that's really what it's all about.
It is. So, I mean, there are 3 reasons you would take it. Protect yourself. Me, I thought, well, my risk is not that high. I wasn't convinced to just take it for myself. For my family, there's plenty of people that are high risk, and I would never want to live without them or give them COVID or spread it to them. And then my community, the numbers were very high. The hospitals were overwhelmed. The frontline staff, I've seen them cry with every patient that they lose because they develop such a connection. It's a lonely disease. They become their family, their support system. They become everything to that patient. They've taken so much responsibility that was never part of their day-to-day activity. They were even the family support system. So with that, I mean, it was a clear answer. Yes, I will be part of the solution. I will take the vaccine and hopefully protect a few people that I can protect. And if all of us do that, I mean, we can hopefully get to normal.
Yeah. We've been talking about personal responsibility. How can people work with UTMB to get vaccinated now that you've given them this great information?
Visit the UTMB website. You'll be able to register. If you are a current UTMB patient, you can go through My Chart and schedule yourself through there.
Or call your primary care office, and they will give you information. They will guide you through the steps.
And there's a couple of kind of, I guess, industries that I've seen that have handled this really well, and that's healthcare, and the schools, I think, have done a fantastic job too.
Agreed, yeah.
And so I want to thank you guys for what you've done. And we really appreciate it, and it's been a pleasure meeting both of you. And just keep fighting the good fight. We appreciate it.
Thank you for having us.
Thank you.
Thank you. Thank you for joining us for another episode of Clear Light Connections. Please follow us on our social media, and you can find our recordings on all of the platforms. And if you want to learn more or become better at business, I encourage you to join the Clear Lake Area Chamber of Commerce so that you can help grow your business. Visit clearlakearea.com to learn more.